All right, and welcome to another Medical Director Minute. Today we're going to talk about an interesting EKG. So, crews were dispatched to a patient having chest pain, reported to be a 47-year-old male. On scene, he kind of reported that he recently had a heart attack about 2 weeks ago, where he had a drug-eluting stent placed in his large vessel, or LAD, and circumflex. He kind of complained of some chest discomfort, a little bit of palpitations, otherwise was well appearing. Crews decided to get an EKG, and this is the KG they got. Let's take a real quick look over this for a second. Let's review what we are supposed to do when we look at an EKG and how do we review an EKG. So first, we're going to look at the rate. Is it fast? Is it slow? Is the rhythm regular or irregular? Are there P waves? And are those P waves come before a QRS? What does our QRS look like? Is it wide or narrow? Are there T waves? And where's our J point? And then do we notice any additional waves, such as Osborne waves or U waves? So let's look at this EKG that was obtained. First off, what's the rate? Pretty fast, a little tachycardic. Is it regular? It appears to be regular. Is there a P wave? Yes. Is there a QRS following the P wave? Yes. So we have a sinus rhythm. Is it wide? Well, this line right here represents about 120 milliseconds, and it doesn't show that our QRS is wide. Next, where's our J point? So if you look at the little circles there, kind of look at our J points. And if you notice, this J point is a bit elevated from our baseline. If you notice, our J point is elevated in V1, V2, V3, V4, and a little bit of V5. We also know a little bit of depression at AVF, but not terrible. You also notice that there's another wave in here and that looks like a PVC. So if you notice, the reading came out as a ST elevation meeting STEMI criteria. So of course, load the guy up and took him to the hospital. But remember, one EKG begets another EKG. You will hear me say this many times. If you get one EKG, especially if it's concerning, get a second one. You're looking for dynamic changes. So this is the second one. If you notice, the STEMI alert is actually gone on this one. It's maybe reading the QRS a little bit long. And this is a third one taken a few minutes later. So every 5 minutes, when a patient's having chest pain, you should be taking an EKG and re-looking at it and examining it for any kind of changes. Remember our STEMI criteria for a heart alert. Patient needs to have signs and symptoms for ACS or acute coronary syndrome. This patient had some chest pain that was kind of concerning to him. And then we want to look for ST elevation of at least 1 millimeter or one small box. Have that J point, look away from the baseline, 2 or more contiguous leads. And what's interesting about this case was this is actually a STEMI mimic. This was a left ventricular aneurysm. And what left ventricular aneurysms are is basically you have some scarring of the myocardium, and that leads to persistent ST elevation. So you have ST elevation 2 weeks after MI. It's usually in the precordial leads. There's usually a well-formed QRS, as we see here in this lead. And the T waves are relatively small in amplitude compared to the QRS complex. It's important to remember that these patients are increased risk of ventricular arrhythmias, sudden cardiac death, congestive heart failure, and developing thrombosis and embolization. So they're increased risk of stroke. So what makes it more likely that this patient had this? Well, first, if we had another EKG or a previous EKG to compare to, it would show no changes. There's no dynamic changes. Like I said, the QRS complex is much more pronounced than the T wave. And also the patient has to have some sort of history of a recent MI. If you see dynamic changes, there's no recent history, you call a STEMI. And if you're in doubt, call a STEMI. So we called a heart alert on this patient, and patient was seen by cardiology. Thank you guys. Stay safe out there and have fun. If you got any questions, please let us know. If you see any interesting EKGs, please send them to us. Y'all have a good day and be safe.